Lovelies, welcome back to my channel. It's Dr. B again. I want to say, guys, I hope you guys have all been good. Yes, you may not ask me, but I've been fine and I'm doing amazingly well. Okay, so guys, you're welcome back today, and today we're going to be talking about something exciting. Anyways, if today's your first time here, I want to say you're welcome. And if you have been checking out this channel, like you just come, you see the videos and you just go, you don't have to keep doing that. You can just click on that subscribe icon to become a part of this family. And if today's your first time, I just want to say that just take your time, just a little bit of your time, and stay with us. And I'm sure you're going to be convinced that you should be a part of this happy family. Anyway, so okay, today I'm going to be talking about a part of the body that a lot of people don't like to maybe talk about so much. You know, that part of the body that we regard as it's private. We don't have to talk about it, you know, like even if we're going to talk about it, we have to talk about it in a particular way, you get. And so today I'm going to be talking about reasons why a lot of women come down with vaginal infections. Okay, now when we talk about vaginal infections, the first thing that usually comes to mind, maybe when a woman comes and she's complaining about vaginal infection, is you want to think about sexually transmitted infection. But you know, if in a situation whereby you have been able to rule out the fact that this is not sexually transmitted infection, and also you rule out the fact that that woman is not, like her immune system is not compromised, you know, maybe for example in people with diabetes or people with immunosuppressive disorders, and you have ruled out all of that, and yet this person keeps coming down with recurrent vaginal infection. The things I'm going to be talking about today are probably the reason why that may be going on. So I'm sure you should be interested in this gist. You're female, you're a male, wherever you are, this is a part of the body that is important to all of us. Come along with me in this video while I take you through all of these things that I'm going to be talking about. So guys, let's jump right into it. Okay, so this is it. I'm going to be starting by saying that, one, I think it's important to actually make a clear distinction between the vagina and vulva. You know, like it's the professions that are health related that pay a lot of attention to terminologies, you know, of different parts of the body. You know, somebody will come and tell you, my stomach is paining me, but actually the stomach is just one organ in the whole of the abdomen. So just the same way it is, you know, a lot of people talk, everything is my vagina, but everything is not vagina. There is, as you can see from this diagram, you can actually see that everything you can see, the mons pubis, the labia majora, the labia minora, everything that you can see if you look at the female external genitalia is the vulva, and the vagina itself is a fibromuscular canal, usually collapses when there's nothing happening. So that is the vagina, is the entrance, or is more like the space or the lumen that leads from the exterior and connects to the uterus that is inside. So the whole of that space is what we call the vagina. Now I think it's important to actually mention here that the vagina is a mucous membrane, and so it's a part of the body that produces or secretes fluid. This is very important because it is involved in keeping the vagina clean. Now when I say keeping the vagina clean, now it's one of the things I'm going to be emphasizing in this video, that the vagina is actually a self-cleansing organ. It doesn't need you to scrub it, you know, like the way you scrub your skin every morning or the way you have to. The vagina doesn't need all of that. And I don't know, sometimes so people just think of the vagina like it's a dirty place. The vagina is not a dirty place, you get. So I don't understand the whole idea of people wanting to wash it, people wanting to, you know, some practices that I'm going to be talking about here that you just like, oh my god, why would you do that to your fluids that the vagina secretes contains of the normal vaginal secretions and dead cells, and this actually help in a way to cleanse the vagina. Another mechanism that is very important in the cleansing or protection of that area is the presence of what we call normal flora. Now normal flora are more like microorganisms that dwell in a particular part of the body. That is, they are microorganisms, but as far as they are within that environment, they are not harmful. For example, in the mouth, we have a lot of microorganisms that their normal dwelling environment is the mouth, and they are not going to cause an infection in the mouth, except maybe there's a breach in the epithelium or something you get that maybe changes the arrangement. Just the same way in the vagina, there are some microorganisms that the vagina is their normal dwelling environment, and they will not cause any harm. Rather, they even protect the vagina from invading organisms. But now, as we go ahead, and I'm going to talk about some of the practices that people engage in that could actually displace these normal floras out of that environment, and by so doing create an opportunity for infecting organisms to come from without and infect the vagina. Now, the third one I'm going to be talking about is the pH of the vagina. The pH of the vagina is actually acidic, and so it makes that environment very uncomfortable for foreign microorganisms. So you see that it is not your washing that actually keeps the vagina clean. The vagina can actually keep itself clean. Hello, do you understand me? Yes. Okay, so now let me just jump into the practices that I said is not healthy or is not good for our vagina. And the first one is chronic antibiotics abuse. Now, in this part of the world, a lot of people are guilty of that. Any small thing on your body, like even if it's one small scratch, next thing, you have gone to a patent medicine store and they have given you loads of medications. Antibiotics will always be part of all those combinations you get. So most times when a person has abused, when a woman has abused antibiotics for so long, it could actually, just like I was talking about the normal flora, it could actually distort their environment by acting on some of the normal flora in the environment, killing them, and then leaving that popular saying that nature actually abhors vacuum. So the thing is, when some of these microorganisms are displaced from their normal environment, that space cannot just be left empty. Invading organisms will come from without and occupy that space and begin to cause infection. So that's why a lot of women tend to come down with infection even after chronic, sometimes not even chronic, after maybe using antibiotics for a long time. Another thing I would like to talk about again is how we clean our vagina. A lot of women, when you use the toilet, when you pee or you poo, you clean from the back to the front. That is so wrong. Like, oh my god, you get. So the thing is, the proper thing to do is to clean from the front to the back. Why? It's funny to say that some people don't even know that a woman's private part has like 3 openings. You have the urethra, which is the first one. Then you have the vagina. You have the vaginal opening. The second one and the third one is your anus. Now, the anus is actually a dirty environment. It means like what is coming from your intestine is dirty now. So if you clean from the back to the front, there's a higher tendency for you to actually move microorganisms from that dirty area down to your vagina and to your urethra. But that's why we advise that you clean from the front, which is like a clean area, and then go to the back and dispose it. Now, the next thing I'm going to be talking about here is our kind of underwear. These days, people don't bloody care about underwear as long as it's pretty, as long as it's, has some lace around it, it's just pretty, and that is just okay. But it's very important as a woman to pay attention to your underwear. Now, when it comes to underwear, I'm going to be talking about the type of material. Now, there are so many materials outside there that they used to make underwear, but what is advisable is cotton. Now, I'm going to give you an example. See, like these 2 pants. See, this is quite pretty, right? This is very pretty, but you can see that is made of nylon, you get, and this is actually very fine, but it's not so healthy for the vagina. Unlike this, you can see that this is a cotton pants. This is a cotton pants, and so cotton pants are more advisable because they allow aeration in that part of the body, because actually that part of the body is the part of the body that we are actually we are not supposed to cover too much, but unfortunately it is that part of the body that we overcover. It actually needs to breathe. So that's why we advise that you should use cotton pants, because they allow aeration better than nylon pants. And also, nylon will allow sweat to form, because there's not so much air around the area, so it allows sweat to form, and that gets that environment just a bit clammy, and that could actually encourage microorganisms. So another thing is the duration. Oh my god, some some ladies can wear their pants forever. I'm sorry if you're one of such ladies. I'm really sorry. This is not planned. I'm not trying to attack you, but the thing is, it is actually not healthy. It is very important as a woman that you have the culture or the practice of changing your undies frequently. Like within 3 months, you should change your undies. Get no sets. You get. So I think it's something that's very important, because you're wearing a pad for a very long time. Oh my God. I think it's something you really should pay attention to. And another thing is how you wash your underwear, where you spread it. Some people just wash their underwear and spread it anywhere. It is not good. It is not advised that you should actually spread your underwear in a damp place. But then, with this whole issue of them Yahoo boys using pata for oh my God, I'm so sorry, using pants for their whole jazz thing. I know these days ladies are very scared of spreading their pants outside, and truly I understand. Like, I really understand. But then what we advise is that if you're going to dry it, if you are not comfortable drying it in the open place, then anytime you dry it in your environment, just make sure that it is not too damp, and if you are uncomfortable with it, you could actually iron it before you wear it. And even for people who spread their undies in open places, it is not so advisable, especially maybe under trees or maybe in bushy environment, because there are some because it is possible for all these flies to actually perch on them, drop their eggs on them and all of that. It is not actually hygienic, and that's why we advise generally that though it is very difficult to do, but it's actually something that is very healthy if we can practice it, to actually iron your undies before you wear them. Another thing I'm going to talk about is antiseptic. I don't have an issue with you using antiseptic. Maybe put antiseptic in your water or whatever, but the thing is, that same water that you have added your antiseptic to should not be the same water you will use to clean your vulva. It is not good. Why? Because all those antiseptics, they are going to actually have a negative impact on the normal flora in that environment. So if you add antiseptic to your water, it's fine. But when it's time to clean your vulva, get a clean water that doesn't contain antiseptic to actually clean. Then another thing I should talk about is soap. Vagina is a self-cleansing area, but the vulva contains, if your vulva has air, and so it can actually trap some microorganisms, it can trap some dirt. Then we talk about the sebaceous gland, that is the oil producing glands, sweat glands, all of them are in that area, and so there's a tendency for that place to be dirty and to be oily. So you can actually use a mild soap to wash your vulva. But auntie, you don't have to put your hand inside to wash your vagina. It is not needed. It is not needed. The vagina is self-cleansing, and you don't need to do all of that. All you just have to do is just use a mild soap to wash your vagina, your vulva, and just clean your vagina with water. Now, another thing and the funny thing is, there's so many kinds of soaps outside there. Scented soap, and all I can say is, please use a mild toilet soap to clean your vagina. To clean your vulva. You don't need an antiseptic soap. Don't use a very ash soap or alkali soaps. You don't need all of that. Just use basic toilet soap. Then another thing I have to say here is, people who are fond of inserting things into their vagina, it is wrong now. It is wrong. The environment is supposed to be a clean environment. You don't have to introduce anything from the external into that space. Oh my God, how can you do that to your vagina? But anyways, I think it's important to actually talk about it, because these days a lot of people do things and you're just like, oh my God, auntie, this is 21st century. How can you do this? So don't be surprised that we still have patients who come and tell you that they were given some herbal stuff to insert into their vagina for the treatment of fibroid and for treatment of various things. And so the thing is, by introducing all of those things, when we talk of sex toys, we talk of different things, anything that involves you taking something from the external and introducing into that space actually has tendency of introducing microorganisms into that space, and so an infection can happen. So another thing that I think is important for us to talk about is our menstrual hygiene. You know, some aunties, because you don't have baby flow doesn't mean that you should use one pad for 24 hours. No, now, no. Because the truth is, blood is a cultural medium for microorganisms. So there's no need for you to keep blood in that environment, you know. Put your pad, you wear your pants, you wear tight, you wear your trouser. Oh my God, the heat is already a problem, and then you now provide the blood that microorganisms are just telling them, microorganisms, please come and have a feast, come and enjoy, come and have a good time. So I think that is very important, because you see that a lot of ladies tend to come down with these vaginal infections after their menses. And so I think it's important to pay attention to your menstrual hygiene. I don't expect you to be using tissue paper anyways. I don't expect anybody to be using tissue paper, because that is a chief in promoting vaginal infection. It is unhygienic for you as a lady to use tissue paper for your menses, and you don't have to use rags. So please stop using rags or whatever, maybe napkins. Please stop using them. It is the appropriate thing to use is your pad. And I know people are using tampons these days, but make sure that it is hygienic. You know, the process of inserting and removing is very hygienic. And so having said all of this, I'm sure I've said so much. And so if you notice that you have been coming down a lot of times with this recurrent vaginal infection, I think this might just be the reason. And taking care of these things and like avoiding these things I've said might just be your way out of this drama. So this is how I'm going to be ending my video today. And I'm sure I've said a lot of things, but feel free to drop your questions, your comments. I'm going to answer all of them. Until I see you guys again, make sure you stay safe, make sure you stay healthy. Don't forget to like, share, comment, and also to subscribe to this channel. Bye.